This is a WDIO News special report.
Press *0. Thank you. I would now like to hand the conference over to your host, Mr. Mark Sommer. Please go ahead, sir.
Thank you for joining us for the COVID-19 media call for October 5th. We'll start today's call with a situation report from Health Commissioner Jan Malcolm and MDH Infectious Disease Director KRIS. After that, we'll open it up to questions from reporters on the line. With that, I'll now turn it over to Commissioner Malcolm.
Thanks, Mike. Good afternoon, everyone. Well, I've been away from these press updates for the last 10 days or so. It's nice to be back with you. Having been away from the daily numbers for a little bit of time just gives me, again, kind of pause looking at the daily data, just how stunning these numbers are and how we can kind of get a little bit numb to them after just hearing them day after day. But a little break just refreshes the mind about how significant of a challenge this has been to our nation and to the world. As of this morning, we're over 35.2 million cases of COVID-19 disease around the world and over 1 million deaths. In the United States, we are now over 7.4 million cases and 209,000 deaths. In Minnesota, we're now at a new total of 104,799 laboratory-confirmed cases. This is up 982 from yesterday on a volume of 23,061 lab tests. We have 3 additional deaths announced from yesterday, bringing our total now to 2,083 Minnesotans who've lost their lives to COVID-19. 2 of these persons were in their 90s, 1 in their 80s, 2 of them in Ramsey County, 1 in McLeod. 1 of these deaths was a resident of a long-term care facility. To date, cumulatively, there have been a total of 7,940 people who have been ill enough to require hospitalization. 2,199 cumulative Minnesotans have been in intensive care. As of now, 367 people are currently in the hospital, 123 of those in the ICU. To put the daily numbers in a weekly context, the weekly change in cases is an increase of 7.4% in total cases over the week prior. That is unchanged from the prior week. The weekly change in testing is an increase of 8.5% in total tests performed, which is a slight increase from the 8.2% of the week prior. Our 7-day average testing positivity rate is 5.2%, which is down a bit from the 5.4% of a week ago today. We have been above the caution threshold of 5% test positivity for 9 days now. We have been above it, we dipped back below it, now we've been above it again. And as a reminder, this positivity 7-day rolling average is based on data through September 26th. Before turning it over to KRIS Ehresmann, I'd like to just give a couple of comments on guidance for safe voting. As we get into the election season, we're hearing questions about how to do this most safely during a pandemic. We've developed some information on our MDH website. The guidance is available there. I'll just give you a couple of key points. This is a great time in the middle of a pandemic for folks to be well aware of all the various ways there are to vote in your area, including early voting or mail-in or ballot drop-off boxes. Voting alternatives that limit the number of people you come in contact with or the amount of time you are in contact with others not only can help protect yourself, but of course can help to minimize the spread of COVID-19 in our communities. We do want to very much acknowledge the hard work that election officials are doing to minimize the risk of transmission really at every step throughout the voting process, and we thank them for their hard work in that regard. In general, we would compare the risk of voting in person probably comparable to going to the grocery store. And while many of us are comfortable doing that, we know that others may want to consider other options. And voting by mail or dropping off your ballot in a drop box are certainly the lowest risk methods as relates to disease transmission. The Minnesota Secretary of State's website has links to all the county election office websites around the state. So you can go to the Minnesota Secretary of State website, find there the link to your local election site, and look there for more information on the specific methods available to vote in your area. Certainly, if you do choose to vote in person on November 3rd, Election Day, there are certainly some things you can do to take some steps to avoid crowds, like voting at off-peak times if you can, such as mid-morning. And of course, as with any activity in public, we encourage you to practice healthy behaviors to protect yourself and to protect others and to help slow the spread of COVID-19, which of course is staying at least 6 feet from others, wearing a mask, using those same good personal hygiene habits to cover coughs and sneezes, washing hands frequently, definitely before and after you go to vote, and certainly stay home if you're sick on voting day and you're sick. You really need to stay at home. It might be another consideration as you think about possibly voting in advance. If you are going to vote in person, it's a good idea to be as prepared as you can to make sure you've got all the information that you need and that you meet the requirements in your county. Again, the Secretary of State website is a great resource for all of that information. You want to make sure that your registration information is correct before you get to your polling location. If you have specific questions or need specific assistance, contact your local or state election office for additional help as you may need, for instance, with voters with disabilities. Making sure you have all the necessary documents with you to avoid delays, and if you can, complete any needed forms prior to arriving at the polling location. You can also consider bringing your own black pen or a stylus for touchscreen voting machines, though the polling places generally do a good job of making sure there are clean materials available. You could certainly bring your own as well. With that, I'll turn it over to KRIS.
Thank you, Commissioner. And I'll say I voted by mail and it went quite well. I'm hoping to be able to serve as an election judge for the election, so that seems like the best way to do things. I'd like to give an update on contact tracing. As we mentioned Friday, MDH is following standard public health protocols in response to news of the President, the First Lady, and others having tested positive for COVID-19 shortly after visiting Minnesota last week. This is clearly an out of the ordinary situation, to say the least, and we've been getting a fair number of questions about who does what kind of follow-up on something like this. The tried and true public health approach is that the entity that does the initial case interview with a positive case notifies other state or local health departments when they find close contacts from the other jurisdictions. We do the same for other states when we are the initial interviewing agency. Minnesota residents who had close contact, that is 6 feet or less for an accumulated 15 minutes or more, should follow our advice as outlined in our statement from Friday. Quarantine for 14 days, and if concerned, get tested between days 5 and 7 after exposure. If you're negative on that test, we would recommend testing again at days 12 to 14. If you develop symptoms, seek health care and follow public health guidance on isolation. It's important to reiterate that if you're a contact and you test negative, that does not mean you don't have to quarantine. As we've said before, there is no get out of jail free card like Monopoly with COVID. Remember that COVID-19 can take several days to develop, and an initial negative test, while encouraging, is not an all clear. That only comes at 14 days, which is the end of the potential incubation period. And with that, I'll turn it back to Mike Schomer.
Thank you, KRIS. Operator, we are ready to take questions.
As a reminder, to ask a question, you'll need to press *1 on your telephone. To withdraw your question, press the pound or hash key. First question, we have Dramer Olson from Star Tribune. Your line is open.
Yes, thank you. I was hoping to get reactions to a couple of news developments today. One starting with an announcement by Fairview Health to move COVID patient, to close Bethesda Hospital and move COVID patient care to St. Joseph. While they're talking about maintaining a level of COVID care in the transition, I still wanted to get comment from you if you have any concerns about COVID capacity and hospital capacity at this time, or whether we've learned enough that we're getting away with fewer beds than perhaps we even thought we needed in the first place.
This is Commissioner Malcolm. Yeah, we are aware of the situation. Appreciated getting a briefing on this just earlier today from the CEO of mHealth Fairview. We were assured by him that capacity for COVID care is going to remain very similar to what it has been now, with the beds being made available at St. Joe's and other mHealth Fairview hospitals as well. So yes, we are feeling reassured that capacity is going to remain about what it has been in total. And obviously, keeping a close eye on this, making sure that we know what hospital capacity is and what it is projected to be needed is going to continue to be a big priority for us in our overall COVID response. And I think we've talked before about just the really unprecedented level of information sharing that's happening among the health systems and between the systems and the state, so that we can keep a very close eye on this. So just reiterate that we will continue to monitor very closely, but that we are feeling still reassured that capacity is adequate.
The second thing that was announced today, departure, was from the CDC. They issued a press statement acknowledging that they have now updated their policy statement on how COVID and how the SARS-CoV-2 is transmitted, at least saying that sometimes aerosolized transmission can happen, but still droplet remains the primary means of transmission. I guess I'm just wondering if you have any reaction to that formal acknowledgement of at least aerosol risk being a sometimes problem, and whether that will shape any of your pandemic response or policies going forward.
This is Commissioner Malcolm again. I'll start and invite Chris to comment further. I think in general we have been saying for some time that following the literature as it's emerged, that we understood that aerosolization was a potential. And I think a lot of our guidance has had to do with aerosol generating procedures, requiring additional vigilance for that reason. So I think that we think it's appropriate for CDC to keep updating its guidance as more and more information becomes available. I don't think we would consider it a terribly new development from our perspective. Chris, would you add anything?
Sure. I think the one thing that I will mention, in addition to what the commissioner has said, is that the circumstances in which they really saw this type of transmission being more of an issue were enclosed spaces with inadequate ventilation, and so, and with crowding, that type of thing. So I think those are some of the messages that we have continued to put out, that any time that you have a situation in which you're indoors with lots of people and you don't have the opportunity to be distanced and you have poor ventilation, that is sort of a recipe for problems with COVID, and this just reinforces that that is a problematic situation. So as the commissioner said, we've been aware that this has been the potential, and that we've kind of been looking at situations in light of the potential for airborne transmission. It's good to have this on the CDC website, and it reinforces some of the messages that we have been giving. And certainly we'll be looking at some of the recommendations that we've made to see if there are any updates that we need to do as well.
Thank you.
Next question, we have Catherine Richard from Minnesota Public Radio. Your line is open.
Sure. So we're seeing an increase in cases in northern southern and central Minnesota, and they've really driven the case increases across the state. I'm wondering whether you guys have any insight into why this is, and whether you think it's linked to any skepticism we're seeing in rural communities around mask wearing and social distancing.
Well, this is Jan again. I think we, as you might recall, a few weeks back when Dr. Burks visited us, she kind of had that observation that she wanted to be sure that folks in greater Minnesota were aware of the speed with which cases can move through rural communities, and the fact that whereas early in the pandemic it might have seemed like this was a large urban phenomenon, that around the country we've seen some of the fastest growing case rates being, in fact, in rural areas. So that certainly is something we've been stressing, that this truly is a statewide issue, that there's no part of Minnesota that is untouched by this. In terms of any specific driving events, I would turn to KRIS to see if you have anything specific you'd like to comment, KRIS.
No, other than just, we've talked about the fact that the consistent things that we've seen that are associated with transmission are those same things I've mentioned as we talked about airborne transmission, and that is, crowding, lack of social distancing, lack of wearing masks. And so any environment where that is happening, whether it's in the metro area or in greater Minnesota, that's where we're going to see cases. And so insofar as, there may have been more instances where people are not following guidance in any particular part of the state, that certainly can contribute. But really it's anywhere where that's happening. And then I think it's important to keep in mind that once we start to see disease, get a hold in a particular area, we start to see it not only in the community, then we start to see transmission back in our long-term care settings and that type of thing. So we'll just add that, but it certainly has to do with mitigation behaviors and the type of exposure, and certainly not the location.
So I want to ask a follow-up question about supplies. I've heard from some physicians at Fairview that they have been told to pull back on testing high-risk asymptomatic patients who had STDs. They specifically singled out gonorrhea and chlamydia because they don't have enough of the swabs and transport vials that necessary to do it. These are some of the same materials that are being used for COVID testing. And I'm wondering if you have heard about this being widespread, and if you've seen any other supply shortages of note, particularly as we've seen testing really increase quite significantly around the state.
Commissioner, I'm happy to take that if you'd like.
Yeah, I don't have any specific insight into that situation, but you raise a good point, Catherine, that with the significant increases we've seen in our testing ecosystem here in Minnesota, it might be good to give you all an update on supply chain and any other sort of systemic issues. So we'll line that up for a future call. But yeah, KRIS, if you could comment on the specific question.
Yep. So, Catherine, we are aware of this. Our STD team has been working on it and is aware, and it is a challenging issue to balance the needs for two different types of diseases, but both there's a need for understanding and having an awareness of both. Clearly, with some of the sexually transmitted diseases, there's treatment, there are options there. With COVID, we need to know the status of someone because of the need to isolate and quarantine. So we are aware of the shortage, and our STD group is working to address that.
And by working to address that, are you saying just finding other supply chains to use? What do you mean by that?
Well, we're aware of the problem, and we're trying to identify, are there other options for testing? What can we what can we do to address this issue. And in fact, there was a meeting this morning that I had to miss that was on that topic because there was another COVID-related meeting. So our team is working on it. I wouldn't say that there's an easy answer, but we are aware and we are working with our partners in STD clinics to see how we can help them address this.
Okay, thank you.
Next question, we have Alex Rokas from KSTP. Your line is open.
Hello? Can you hear me?
Yep. Yes, we
Hi,
can.
sorry. This is Alex with KSTP. I know you had kind of touched on the Bethesda news that we had talked about a little earlier in the call, but I was curious, was this news surprising? Did you guys know that the hospital was going to be closing? Of course, you know it's the only hospital in the state that exclusively treats COVID patients. And so just curious if you were expecting this or if it came as a surprise.
Commissioner Malcolm here. Well, I had not been aware that, of specific plans, but I think certainly there are conversations going on, pretty much all the time in every health system about maximizing resources and looking at future care models as as our systems continue to evolve. I think again in the conversation with the mHealth Fairview CEO today, he was very much stressing the learning that they have had with the focus on COVID exclusively at Bethesda, and they've migrated that to many of their other hospitals, and certainly will be kind of carrying that forward into the dedicated unit at St. Joe's as well.
Okay, is there, I guess, any further reaction to this update?
Any further reaction to the Bethesda update specifically?
Yes. Yep, the closure of Bethesda as a COVID-only hospital.
Yeah, I think, again, with the important thing is that capacity continue to exist in the system, and that the really the excellent learning and the great outcomes that they have seen get really kind of spread throughout the system. So again, we don't have any reason to think that this is going to create a capacity crunch in and of itself.
Okay, thank you.
Next question, we have Walker Orenstein from InPost. Your line is open.
Hi, can you all tell me if you know off the top of your head how much money that Fairview got from the state's COVID fund and from the CARES Act? Just wanted to see if there was even a ballpark there.
That is certainly information we can look up. I don't have that at my fingertips right now. And I'm not sure if we know about the federal CARES Act funding, but I'm happy to follow up with you offline about that if you'd like.
Okay, thank you.
Next question, we have Tom Hauser from KSTP TV. Your line is open.
Hello, good afternoon. I had a question getting back to the president's visit here last week. And KRIS, you were talking about the 15 minutes of exposure to someone, I think close exposure. Would that include a scenario like the private fundraiser where there were 50 to 70 people there, no one got within 6 to 10 to 12 feet of the president, he didn't shake any hands, but he was there for about 90 minutes. Is that considered close enough contact for a long period of time to warrant people needing to get tested?
Well, certainly the individuals who attended the event will need to evaluate their experience where were they in the crowd, that type of thing. The guidance that we provide, is intended to kind of give a broad way of looking at a potential exposure. So in other words, is 14 minutes and 30 seconds of accumulated exposure fine, but 15 minutes not fine? We aren't able to be that nuanced. And so our guidance really has to do with, we want people to evaluate their situation. If you attended that event, you were in the far back corner of the room, and you wished you had brought your binoculars with you, probably it's a situation where, you can use your judgment. But I think we want people to certainly have an abundance of caution. We know that the president was present, was infectious, and so people should be, evaluating where they were in the room. And as I said, it's not just consecutive exposure. So it's not that you need to have been 15 consecutive minutes, but if you had 5-minute increments over the period of the event that totaled 15, that would also be concerning. So it is slightly more nuanced, and we certainly want to encourage people to have an abundance of caution. We've obviously seen the number of cases that are being identified amongst individuals within the White House circle, and so I think people should, be considering all of those things as they're evaluating what type of exposure they think they may have had.
And as a follow-up to that same day, could you also address the same question when it comes to the roughly 5 minutes the Senate Majority Leader, House Minority Leader, Senate candidate Jason Lewis greeted the president on the tarmac, again, for about 5 minutes outdoors. They didn't shake hands. For the most part, they were 6 feet or so away, but it was for a short period of time and some quick pictures. If you could address that, and then also the 3 congressmen who were on Air Force One, should they have been flying so soon after their exposure, even though they tested negative? And I know that's 2 questions there, but I'll let you have at them.
Well, certainly, I think our guidance for anyone would be, that within 6 feet for 15 minutes or more. So I was not there, so I cannot assess the situation for those individuals that you mentioned, but any exposure that was, within 6 feet for more than 15 minutes, and certainly, being on a plane is a very much of a different situation than being outside with greater ventilation. And so that's another consideration. But I think in general, our guidance is that if you have been exposed to someone who's COVID positive, you've been within 6 feet of them for more than 15 minutes, that would be an exposure of concern. Those individuals should quarantine for 14 days, and a negative test, as we mentioned earlier in the call, a negative test does not it's not a get out of jail free card, as we like to say. And the reason for that is because you have been exposed. The incubation period is from 2 to 14 days. And if you get tested on day 4 or 5, that's great that you're negative, but you still have the entire rest of the incubation period in which you could develop illness and could be infectious and transmit to someone else. And that's why, even if you have a negative test, you need to be quarantined for 14 days.
So you would not have recommended that they fly on Friday so soon after exposure? No one asked, but we've been pretty clear that for anyone who has an exposure of more than 15 minutes and closer than 6 feet, that we recommend that those individuals be quarantined for 14 days. Okay, thank you.
Next question, we have Sarah Kosher from St. Cloud Times. Your line is open.
Hi, thanks so much for taking my question. I want to return briefly to Election Day. I know that there's been some concerns specifically around election volunteers, as oftentimes those tend to be older adults. And so I'm curious if you have any specific recommendations for people who may fall into that higher risk category, in addition to what you've already told us kind of about what MDH recommends regarding the election.
Well, I think we certainly all appreciate the important role that election workers play, and we're sure that that is a consideration for many as to their comfort level in doing that this year. I think it's part of the reason that many, kind of voting education organizations have really been, encouraging folks who are in lower risk groups to consider volunteering this year. So we hope that people who are in a position to do so will consider that, and that folks in higher risk categories by virtue of their health conditions or perhaps age just kind of consider all those variables and make sure that they're comfortable with the protocols in their polling place, and that they just are supported in making the best decision for themselves.
Thank you.
Next question, we have Stephen Joyce from Bloomberg. Your line is open.
Thank you very much. Director EHRESMANN, I just want to make sure that I understood you correct when you said that the jurisdiction of an event is with that local jurisdiction, because I talked to the Duluth people today at City Hall, and they said, we're not doing any contact tracing. That's a responsibility of the Department of Health. So can you clarify that for me, please?
Certainly. Yeah, I think what I was trying to convey in our earlier comments was that the president, we've gotten asked quite a bit about follow-up on the president specifically in his activities. And so not only is the president, so he is not going to have time to talk to our case investigators, but he's not a Minnesota resident. And so I was intending to say that the jurisdiction that does the follow-up, whether it's, in a different situation, whether it's the state of Montana or the city of Chicago, that whatever jurisdiction that does that initial follow-up, they would be the ones that would reach out to any other jurisdictions in which they identified cases. So if the city of Chicago was interviewing a case and identified exposures in Minnesota, they would reach out to us and we would work together to address that. So that's what I meant by that. In terms of the follow-up that's being done in Minnesota, yes, we have some local jurisdictions that are doing follow-up in their area, and then others that are relying on the broader kind of state support for that. And so in the case of St. Louis County, they're working with us. But the specific comment that I made earlier had to do with the fact of the home jurisdiction of where an individual resides. They would be the ones that would do the initial interview and then reach out to other states or local health departments to follow up with them. But as I said, the president is obviously a very unique situation, and so that's being handled a bit differently.
All right, so then the case is that there is contact tracing going on right now, and if that's the case, who's doing it?
So if we have identified someone who was part of the event, who's tested positive, then the state will be doing that. Or if it's a situation in which the jurisdiction, the local public health department, say Olmsted County, they are doing their follow-up. If the person resided in Olmsted County, then they would be doing that follow-up, or Hennepin County. So it really depends on if that jurisdiction is doing direct COVID follow-up. But in Minnesota, we have a network. So the bottom line is the public health system in Minnesota is doing that follow-up.
Okay, and then my follow-up question is, have you asked for help from the White House or the CDC, and have they given it to you?
No, we have not asked for specific assistance The follow-up, although the president is obviously perhaps the most well-known person in the world, the actual case investigation and contact tracing elements of this are no different than for any of us. And so we're following up on these situations just like we would any other situation of exposure in Minnesota.
Operator, we have time for one more question.
Next, we have Catherine Richard from Minnesota Public Radio. Line is open.
Hi, I feel like that last question begs this question, which is, have you actually identified anyone so far who's tested positive at any of the Trump events, or even had to be contact traced because they were exposed at these events?
We have not identified anyone who's tested positive. As you know, our teams are constantly looking for clusters of cases associated with any sort of group setting, and our awareness is heightened because of the situation with the president, and we have not yet identified any positive cases at this point.
Or potential I just want to be clear, like positive cases or potential exposures?
Correct.
Okay, thank you.
That's all the time we have for today's call. We invite any reporters with additional questions to reach out to our communications office this afternoon. Have a good day, and we will be back with you again soon.
This has been a WDIO News Special Report.